Hi, this is Dr. Eric Westman with Adapt Your Life, and today's episode is about medications on a keto diet. A lot of questions, most of them fall into the categories of what medications can interfere with weight loss or ketosis. Is there a need for extra medication or supplementation? And how do you taper medications, especially if your doctor isn't aware of how to do it? So maybe I'll give you some useful pointers in these questions. So Larry asks, I know the list could be long, but could you tell us a few of the most commonly taken medicines that would spike insulin or create an issue for people eating ketogenic? Well, I think of it, Larry, not just in terms of spiking insulin, but other effects that can happen from medications or other supplements. Insulin isn't the only mechanism, I think. Of course, insulin itself is a common offender. If you have diabetes and you're taking insulin, this is going to be a problem. That's why we try to get people off insulin as fast as possible. Steroids are probably the number 2 offender. And while most people think of a steroid pill as the only way, no, I've seen people have trouble with nasal sprays that have steroids in them, also joint injections that have steroids in them. So anything that affects the body, a steroid. I don't know about steroid skin preparations. I'm not so concerned about those. It seems the dose is much less, but steroids are a big one. Oral diabetes medicines, antidepressants, pain medicines like gabapentin. I'm afraid I've become that doctor I looked up to and didn't believe with the saying that consider or suspect that any drug might do anything. So as a lifestyle doctor, I don't rely on medications. In fact, I try to get people off medications. If you're on one and it's not helping, if it's not doing the intended effect, why are you taking it? I mean, often doctors won't even reevaluate if the doctor isn't sure the medicine is working. They'll just keep you on it. Judy asks, what about beta blockers? Well, this is interesting because in theory, the beta blockers can block the fat burning, and there aren't many good studies on that, but if you can switch with your doctor's approval to a different medication, especially Judy, because you're taking it for a heart condition, be sure to do this or any medication change with your doctor's approval. Lisa asks, what about Pentasa for Crohn's disease? Having a flare and a lot of trouble, weight loss has stalled. Well, that's interesting. Pentasa is not a steroid, but it could be that the flare of the inflammatory disease, whatever it is, including the Crohn's, could make the stall by itself, even without the drug treatment. I've seen a few cases of the Crohn's or ulcerative colitis get better over time. That's one of those things I would just reassure you about. All other things equal. Kelly asks, what about St. John's wort for mild depression? Will this keep me from being in ketosis? You know, I don't know. I've never seen a study on that. So now if you're faced with a doctor that, like me, that doesn't know, and if you came to me, I would help you to try a test without the medicine. Of course, it has to be a disease that's in a stable phase. So if the depression is not severe and your doctor says, well, sure, let's try you with a trial off the medication, then what you do is you change the medicine for, I would say a couple weeks before you truly see if there's an effect on the weight loss and ketosis. But this is true also, Tishera, for a medicine like Topamax. So Topamax is supposed to help you lose weight. In fact, it's been used in some cases for that. It's included in a new drug for weight loss. But if you're having side effects like hair loss or other, numbness and tingling in the fingers, you might try without the medication, wait for a few weeks. Of course, if the disease that you're using it for, a lot of people use it for migraines, if that comes back, then of course it's worth being on the medication. Again, that's where that clinical judgment is going to be important, and working with your doctor to monitor the medical condition before you do any sort of tapering or fiddling. So along that line of tapering medicines, Jane asks, my husband's on 2 low-dose high blood pressure medicines. He's lost 35 pounds. He has 2 months of history taking his own blood pressure, which I encourage at home. you don't live at the doctor's office, you live at home, and the doctor didn't care to discuss the diet or the blood pressure medicines. So whenever the disease is in a stable phase or even a little low, like the blood pressure is a little low, I like to try tapering the medicine with monitoring. And you might do that cutting it in half and watching the blood pressure, cutting it in half, watching the blood pressure as a tapering method. Depending on the medicine, I usually taper it over a period of a couple weeks, again, as a way for your body to adjust to the change. Linda asks, what about thyroid medicines? I've been on thyroid medicine and I've lost all this weight. Is it possible to get off them? Again, that's one of those judgment decisions with your doctor. If you've made a major life change, metabolism has changed, it's possible that you might be able to change the hormones as well. And you want to do that with monitoring of the clinical symptoms, the feelings of low thyroid or high thyroid, and also the blood levels, I believe. Another line of questioning was, is there a need for medicine? For example, Jackie asks, what about if you don't have a gallbladder? Do you need to add something in? No, I don't think so. I have a lot of people who don't have gallbladders and they handle the fat just fine. Franci asks, what about the beginning morning blood sugar that's a little elevated? Should I take a medicine for that? I don't think so. And I see some people with the blood sugar 100, 110 every now and then in the morning. I just kind of reassure them that this is fine. I don't always see blood sugars in the 80s and 90s when people are adapted to a low-fat or keto diet. Now, I don't think that's any cause for alarm. What about the statin drugs? My doctor's an advocate. Well, this is an area, of course, fraught with controversy. I've found a website to be very helpful that boils down the latest U.S. clinical guideline. And so I'll ask people to put in their information into this website, and it will give you the latest guideline. And it's actually, if anything, pushes towards statin drugs. So if it says you don't need a statin on that guideline, I would show your doctor that, and as ammunition that you probably don't need it. And the website is cvriskcalculator.com for cardiovascularriskcalculator.com. Check that out, Hanna. What about over-the-counter medicines? Well, you want to watch out for cold and flu medicines with sugars, things like that. But again, you might need it for a week or two to balance out the symptoms of the disease. And hopefully the cold or whatever you have will get better. What about natural supplements in LCHF? People talk about supplementing magnesium, potassium, vitamin D. Yeah, I've heard just about every supplement. In my experience, I teach people using regular food, whole food, as much as possible. You should eat this, whole foods. And then I do recommend a multivitamin without iron, unless you've been told to take iron for some other reason. And most people don't need any extra supplementation with this advice. If someone has a symptom like muscle cramps or constipation, I'll add back some magnesium then. And that way I'm not treating people unnecessarily with extra electrolytes, and only those who need it will need the extra supplementation. Now you might say, well, I don't want to wait and get a side effect or risk that, then taking a little extra magnesium and potassium might be a good thing to do. That's the questions on medications for ADAPT this week, and thank you for watching. Please sign up to or subscribe so you don't miss out on any future episodes, and we want your comments and suggestions for further episodes. I hope that's helpful.